The market size for my wellness plan is clearly defined. There are just under 4,000 covered lives in our self-insured health plan, of which about 2,000 are employees. I predict that there will be little to no growth in this consumer segment due to the reductions in volumes for our company that were due to a variety of factors. Our hospital system recently reduced about 100 employees, or about 4% of the workforce, due to the overall volume changes. We will target specific populations for my wellness plan. Our Chronic Disease Therapy Management Services, or CDTM, will target those with type 2 diabetes and heart disease. We will also target those with high prescription utilization rates for those customers that have 5 or more chronic medications. We will seek this target for potential conversion of brand medications to generic alternatives. For purchasing patterns, our employees have extremely high utilization rates in the use of ER visits and brand medications. I've estimated that my business plan could save potentially over $1 million annually if we are able to divert a portion of these ER visits to our on-site clinic services. I also know that our customers' use of brand medications is well above the norm and will be a target segment, as previously mentioned. Our customers' buying sensitivities are exemplified by the high ER utilization rates. They see access to ER services as a convenience. We must exceed this convenience factor for our on-site clinic, along with providing convenience for all other services. We must also provide consistent education of the benefits for wellness that resonates with the consumer. Advertising of services will complement these factors that will address the consumer's buying sensitivities. Consumer trends will be a strength of my business plan. Although progress has been slow, Americans have gradually moved towards a more enlightened state of what wellness means to them. This is especially true for those who work in healthcare. I consider this trend to be natural as our society becomes more mature and educated. Another key factor to this trend is the affordability of healthcare. Premiums for healthcare are rising at a considerable rate for all consumers, resulting in significant financial constraints for most citizens of the United States. As healthcare expenditures rise, these costs will continue to be passed along to the customers. This trend will assist in our use of incentives for employees and families to embrace the idea of wellness services.